Good afternoon. I am Dr. Patrice Harris. I'm the Chief Health and Medical Editor here at Everyday Health, and it is an honor and a pleasure for me to interview Dr. Leroy Sims as part of our Black Health Facts Change Maker series. Dr. Sims is an emergency medicine and sports medicine physician at Mills Peninsula Medical Center in Burlingame, California, and Senior VP of Medical Affairs for the NBA. And Dr. Sims was instrumental in organizing the bubble. I know he had a team, but certainly I'm sure it was due to his leadership that allowed the NBA 2019-2020 season to continue more than 4 months after it had come to a halt because of COVID-19. So let's go back to January and February of 2020. You were in Paris with the NBA, and of course, we were all beginning to hear about the pandemic. We know now, but we didn't at the time. So based on what you were seeing and hearing at the time, what were some of your earlier thoughts? And of course, as related to how this might impact the NBA?
The NBA is a global organization. We're a sports institution, but also entertainment and media as well. And we have offices around the globe, including in China. So early on, we were getting information about what was happening in Wuhan and looking to see what was happening. None of us knew then that this pandemic was going to happen. We knew there was an outbreak and wanted to know more information. We sent our first memo to teams and staff on January 31st. And at that time, alerted them about the situation, what we knew about the virus transmission. We highlighted public health prevention measures, hand washing, symptom checking, distancing. And that was the beginning of it. So the earliest thoughts I have from Paris was preparing those memos and talking points, reviewing what was being said by WHO, CDC, talking to our counterparts at the US Embassy and consulates in China to get as much information as we can to alert our staff about the situation. Again, not really knowing where this was going.
And then Dr. Sims, just a couple of months later, on March 11th, the 2019-2020 NBA season was suspended. And I remember thinking, certainly as a physician, and I was president of the American Medical Association at the time, clearly what we were hearing had my attention. But I've said this before to you that when the NBA suspended their sentence, I think it made us all stand up and take notice. And so you suspended the season March 11th, the NBA did. How soon did you start thinking about next steps and when and how the season could resume?
Recall, Dr. Harris, that when we did suspend the season on March 11th, that suspension was meant to be for 30 days. So we wanted to see how the situation played out, what was happening in terms of transmission and cases, and what we could do in terms of resuming our season. But as you know, the pandemic really started to unfold, cases started to increase, and that 30-day period was upon us, and it was clear that we wouldn't be able to start right then and there. But a lot of collaborative efforts started to go into place. We were talking to other organizations, asking questions, gathering information. We started to seek out experts in epidemiology, infectious diseases, certified industrial hygienists, statisticians, to see what was coming and if we were going to start to plan to resume, how we could do it, where we could do it, and in what manner we could do it the safest. So after we got to that 30-day period and we knew this virus was continuing to emerge and new information was coming out about asymptomatic transmission, the utility of masks, the presence or lack thereof of PPE for healthcare providers, lack of ventilators, all of that we were absorbing and trying to see, does it make sense and for us to resume? And if we are going to resume, what's the best way we can do it? And so we searched far and wide and engaged the best and the brightest to help us come up with ideas and a plan.